Hey friends, Dr. Christy here, and I want to talk to you today about what I feel is one of the most important muscles in the body, and that's the diaphragm. So for those of you who don't know, the diaphragm is this big muscle that literally it comes across underneath the rib cage and it separates the chest cavity from your abdominal cavity, and it is responsible for allowing you to take in deep breaths to fill up your lungs with oxygen. Right? So every time we take a deep breath and the lungs expand and fill with air, that's because the diaphragm, that muscle that's sitting underneath here, is sitting there and it's pulling down so it allows the lungs to expand. If that doesn't happen, if your diaphragm's not active, you're not going to be able to take full deep breaths, and it could allow you to be more shallow. Chest breathers have a notorious issue with not oxygenating their tissues, being in more pain, having more sluggish attitudes and energy levels and things of that nature, right? So making sure that your diaphragm muscle is optimally functioning is incredibly important. I also like to mention that in Chinese medicine, the diaphragm is essentially the muscle that kind of is the primary mobilizer of qi through the body. Qi being that energy that allows the flow to move through your meridians in the body. So if that diaphragm is not working, you could be vulnerable to many ailments, many conditions, and all sorts of issues, right? So how do we know if the diaphragm is not working optimally? Two tests. First off, I want you to just put one hand across your chest and one hand across your abdomen, kind of just like that. And I want you to take a deep breath in. If your hand on your stomach doesn't move as much as the hand on your chest, you may have a diaphragm issue. The other way to find out is if you go underneath your rib cage, and I'll kind of show you back here. You go right through here and push in with a little bit of pressure, not trying to puncture yourself, of course, but right under there on both sides, you might find some trigger points and some tender spots. When you find those things, those tender spots, that's essentially a trigger point in your diaphragm. So if you feel a trigger point in your shoulder muscle or your leg or your low back, obviously that's going to contribute to musculoskeletal discomfort and other problems that are going to prevent you from going about your day and firing those muscle patterns in the way that we want for optimal musculoskeletal health and function, right? But the diaphragm being so important, if you've got trigger points in your diaphragm, that muscle doesn't work optimally, which compromises your breath, compromises your oxygen, which then compromises your brain activity, heart activity, everything in your body. So it's a pretty important muscle. I encourage you, if you do find any of those tender points in that diaphragm when you poke, and guess what? I just too. Everyone has a couple of those. Play with them a little bit. Do some gentle massage, do a little bit of trigger point work. If you see a massage therapist regularly, ask them if they do any of that type of work, because it can be really helpful to get some of those trigger points out, and then drink more water to flush any toxins that you stir up out of the body. And it can be a really, really helpful system to really allow your lungs to expand at a better level and basically reignite the energy that your body's supposed to be having on a regular basis anyway. Questions, drop them below, and I hope you all have a good day.